Hello, good evening. I hope you've had a nice day. This evening I'm going live with Dr. Emma Wedgeworth. She's absolutely fab. She's a Harley Street dermatologist, and we're basically going to have a big chat all about rosacea. I've had lots of different messages about it recently, and I'm just having this chat with Emma to really delve into it. I can see her here, so I'm just going to bring her in. Here she comes, hopefully. And I'll put a little note at the bottom of this video so you know that we're talking.
Hey.
Good evening. How are you? Well, that is the fanciest quarantine blow dry I've seen in quite some time, Emma.
Rose, don't. I'm loving it. I'm loving it. A little bit of tongs.
Absolutely.
It's hot, and I'm like, oh, my hair was looking a bit thin. Oh, thanks. I'm so grateful that you're actually appreciating it.
Absolutely.
My kids are like, what? That's the only other people that I've got to appreciate it here. So I'm loving it. Thank you.
Absolutely. Do you know what? It makes a difference though. Well, I had a bit of makeup on today and I did a top up, but it does make a bit of a difference, doesn't it? That you just feel a bit more put together.
Yeah, of course. And also, I mean, when else am I going to do it? This is like highlight of my week,
Exactly. I'm counting down to the Sophie Ellis Bextor Kitchen Disco tomorrow. I haven't shut up about them all week. It's the best thing I've seen since we've been in the quarantine. It is the best thing I've seen, full stop.
Amazing. Rose and I share a bit of a love for, is Sophie Ellis Bextor 90s?
She would be the early noughties, but I'd say she might have been end of the 90s as well. But it's our kind of era.
So I get the 90s and the noughties all in one. But that looks awesome. But you're doing well?
All good. I'm literally armed with questions here, Emma. So since last night, I basically said we were having this chat. In fact, I'm just going to leave a comment so that everybody knows what we're talking about. Rosacea chat with Dr. Emma. I have just been inundated with questions for you. So I just cannot wait to get stuck in. I think the thing is, Emma, with rosacea, it's so different for everybody, and you might follow someone else's recommendation and then that doesn't quite work for you. And it's just a case of trying to find the things that are kind of universal tips that are going to work for everybody, and then navigating your own skin around that, would you say?
I think that's such a good point. And I think actually just trying to find what works for your own skin is one of the key things to having a really successful skincare regime, because we are all different. And if we're talking about rosacea, we know there are lots of different types of rosacea. And so what works for like one person that has rosacea might not work for the other. So you're absolutely right. Trying to find what the right thing is for you is absolutely key.
So like back to basics, I've had a few people recently say I've got redness in my skin, but I'm not sure if it's redness or sensitivity or if it's rosacea. How would you describe rosacea itself?
And again, a great point, because I think that it's a massive spectrum, and some people can have really mild changes and some people can have really severe changes. But essentially, rosacea is a condition which is sort of characterized by three things, I think. One is sensitivity of the skin. So you might be prone to redness, dryness, flaking, and you might be very sensitive to products. And then spots, which can come up intermittently, and they're sort of like the red spots, which often can happen in the cheeks, and they're really common, like mid face. So not so much like those hormonal breakouts that people tend to get there. And then the last thing is the flushing, and that's a problem with the blood vessels that sit within the skin. And so I think it's really like a group of those conditions, and some people can have, say, like the flushing really badly, some people can have the spots really badly, some people can have the dryness, some people can have all three. And I think if you are developing a little bit of redness a little bit later on, you probably have got a mild form of the flushing type of rosacea.
And so when you've got a combination of all of them to manage, because that's exactly me, to be honest, like sometimes I'm just flushing, other times I'm flushing, and I mean last week in particular, the spots, it's very frustrating because it actually looks like perhaps acne or whiteheads, but then that can go in a period of maybe 2 days and it's completely gone. How would you say, is there kind of a set of starter tips that if someone is noticing this redness or thinks they have rosacea, are there starter tips that are good for everybody to consider doing with the routine if they think they're rosacea prone?
Definitely. And that's the fantastic thing about skin. Like, there is actually so much that you can do on a day-to-day basis. I'm not sure if it's the same with like lungs and liver and other organs, but like skin, there is so much that you can do.
Yeah.
And I think one of the key things is about what we put on our skin, because we're constantly, and particularly at the moment, we're all on Instagram, we're all trying to like find out the latest thing to try. And you've probably tried like a million different things, right, over the counter.
Yeah.
But
And
I think,
you know, it's funny you should say that. I think that the thing that made me get a handle on it a bit better was stripping it right back. And I very rarely change my routine now.
Exactly. So it's, I think for all rosacea sufferers, keeping the skincare really quite gentle, because if you do that, what you're trying to do is repair your skin barrier. So our skin's got this ability to act like a barrier, and that's sort of what it's supposed to do. And basically, if we use lots of harsh like alcohols or acids or things like that, we start to strip it down. Whereas if we actually use really moisturizing ingredients, we avoid, say, foaming cleansers and things like that, and we put really nice rich moisturizers on, we really build up our skin barrier. And I think pretty much for all people with rosacea, building up your skin barrier is absolutely key.
So if I kind of go back to a routine, start to finish, I know you just mentioned there kind of try and avoid the foaming cleansers.
Yeah.
Do you have some recommendations of cleansers that are really good?
Yeah, absolutely. I think again, with this, it's about trying to sort of match it to your skin type, because even though some people have rosacea, they can be quite oily, and they can also get problems with like breakouts. And then they're constantly veering between saying, I'm like, my rosacea's flaring, but then I'm breaking out, and then they really don't know what to do. So I think or everyone with rosacea should avoid sort of foaming cleansers and go for a cream-based cleanser. And I probably would avoid sort of, she's got one.
Yeah, got one. It is a game changer, the cream cleanser, to be fair. Yeah,
absolutely. So is that Effaclar H by La Roche?
That's the one.
So if you're a bit oilier, that one's a great one.
Oh, brilliant. Okay. I've bought a few bits to just do a bit of a show and tell.
I love you.
Why
You're
not?
so organised. I've just
Absolutely.
like thrown myself here with my blow dry.
Well, your hair is the star of this show, and I've got the products, so we both bought something. I do like the Kate Somerville goat milk, and the reason I like that one as well is you feel like if I'm particularly dry, you almost feel like you're cleansing with a moisturiser. Yeah, it's very rich, which can be nice.
So you know what, you can actually cleanse with moisturizer. So if they've got sort of very gentle like fatty acids, that not fatty acids, fatty alcohols, they're like moisturizers, but they act as cleansers. So for very sensitive skins, absolutely right, it feels like you're washing with a moisturizer. And as a dermatologist, what we tend to say is if you've got like eczema, for example, different condition, you just wash with your moisturizer. So you absolutely don't need that really like squeaky clean feeling that I think everyone thinks you do need to get a good cleanse, but you don't.
And I think that that's one of the things that you have to adjust to. Like, I used to use everything and try everything and always be on the hunt for something new. And it was only when someone advised me, just strip it back, just keep it really simple.
Yeah.
And you miss some of those things. You miss, you know, for example, I really miss a really nourishing, rich cleansing balm. And I love how quickly that gets your face off, and it does. But I notice the difference now in the texture of my skin from using the creams rather than some of those other formulas.
Exactly. So I think for most people, a cream-based cleanser, it doesn't foam. Actually, that's a really great way of removing makeup. And sometimes people are like, oh, but it still feels like I've got stuff on it. And I think if that's the case, then making sure that you use enough product, so about a 2-pound coin size of product, use tepid water. So don't go for really harsh water, because in rosacea, that can definitely flare things up. And you very gently massage it in for quite a long time, so like almost a minute or so. And that will get the makeup off. And if you need a little bit more makeup removal, a micellar water, like a very, very gentle micellar water. She's got it.
Here's one we made earlier. I've got, to be fair, I've got quite a few La Roche-Posay things here. I have bought a mixture of things. Yeah. But Emma and I were saying earlier, I kind of came back to my mum and dad's just before the lockdown. So I grabbed all of my essentials, and that does happen to be a lot of the La Roche-Posay things. But there are quite a few brands that we both kind of like and would recommend and what have you. What I might do, Emma, if it's okay, is I'd asked people for a few questions, and I can see one here, and it actually matches some of the things I was going to come on to ask you.
Yeah.
So one of the first ones that I can see Kerry's asked here as well is, how do you get around using retinol if you've got rosacea? Because like for me, for example, I actually do want to start using that, but I'm terrified to.
Yeah. So I think that if you have rosacea, you can use other active ingredients, but you have to be super, super careful. So the first thing you have to make sure is that your rosacea is under good control. If you go in, if I like see people in clinic and they've got rosacea and I go in with a retinol when it's really active, it's not going to work out well. So basically make sure that your rosacea is as calm as it possibly can be. And that means that you're not going through that stage where everything's really, really like red and flaky and dry and you've got loads and loads of different spots. So pick a time when everything is actually quite calm. And that's a great time to try and add in an active. And then add in one at a time. So the question was around retinol and niacinamide, Kerry was asking. And just say, Kerry, like niacinamide is actually really quite good for skin barriers. So you might want to introduce that first because it's often easier to introduce in the context of rosacea and it can sort of help boost things a bit and help your skin tolerate other stuff. So add that in first, give it a good 6 to 8 weeks. Remember, this is like a marathon, it's not a sprint. This is something that
it's very true. Yeah, it is very true.
And then I think with the retinol, it's to pick a really simple formulation. So to try and pick something that doesn't have lots and lots of other ingredients in, because I think sometimes that's a challenge. It's got retinols, but it's also got, you know, salicylic or BHAs or botanicals or something like that. Pick a really gentle formula. And then very, very slowly, like literally once a week for a couple of weeks, twice a week for a couple of weeks, mix it in with your moisturizer and see how you go. But I've done it really successfully with some people. So I think...
Are there any that come to mind of like ones that we should Google?
Yeah. So I work with another dermatologist called Sam Bunting, and her nightly serum has got a mild retinol in it, and that's fantastic because it's also got a little bit of azelaic, and that goes slightly away from what I was saying about add one ingredient at a time, but it's a great, sorry, I just contradict myself, but it's a great formulation. So that's one, her nightly serum, Dr. Sam Bunting's Flawless Nightly Serum. The other ones are even things like The Ordinary. So starting, if, you know, they're such a sort of good budget range, but if you're starting, just go for the simplest, gentlest retinol that they do. And they've got a good website in terms of that. If you're going for the more luxe brand, then SkinCeuticals does a great retinol at 0.3%. So that's a good place to start. But these sort of like really start low percentage. Clinique does a good one, which is very low. I work with Clinique, disclosure, but they actually do a really nice one for sensitive skin as well. So there are a few different brands that you can use. But you just go gentle and you'll know, you know, if you do it once or twice a week, you're not going to suddenly like, boom, light up like, you know, I don't know what. But yeah, I think you can.
And then I've seen a few people mention, I'm going to try and keep an eye on these and make sure I don't miss anything. Azelaic acid, Emma, what do you feel about that, and kind of azelaic acids that you can buy versus what you would get prescribed from a doctor?
Yeah. So azelaic acid, I love. I think it's such a good ingredient. I think it's really helpful for rosacea. And it's also got general nice properties. So I'll use it for rosacea, but I'll also use it for like anti-aging purposes and skin retexturizing and helping with pores and, you know, all sorts of things. So it's a great ingredient. And it's a really nice one because you can sort of keep going with it as well. You know, I think one of the important things about rosacea is if you've had a flare and then it's calmed down, you want something to try and maintain it.
Yes.
Yeah. So I think The Ordinary 10% is a really nice one.
Do you know what? I just got that quite recently.
Yeah.
I know I was mentioning to you earlier, Emma, but for anyone that wasn't on the phone to us earlier on, I was using a prescribed azelaic acid and then I'd run out of it from the doctors, hadn't got round to going back, and I started using the one from The Ordinary, and actually I did really like it. It's not as strong, so I didn't see the same results as the prescription, but I definitely saw a noticeable difference for perhaps someone that's, you know, giving it a little think about or wants to give it a go.
100%. And you know, if you've got reasonably sort of mild changes and you want to prevent them from getting worse, I think that one's a really good one. Jan Marini does something called Redness Relief, and that's also got azelaic acid in it as well. So those are both really good over-the-counter options. You can basically get 10% azelaic acid, up to 10% over the counter, and then when we use it on prescription, we use 15 and 20%. And you are so right. You know what, you do see more sort of benefits with those, but not everyone has access to to a doctor, and particularly at the moment when it's so difficult. So definitely ones to start with over the counter, and then the prescription grade ones can be something to sort of move on to.
Okay. And then another ingredient I think that, funnily enough, I was quite frightened to use, and I've recently introduced the SkinCeuticals CE Frulic, which I'm getting on really well with. But what would you advise for anyone that wants to implement a vitamin C?
So when I'm thinking about my rosacea skincare and like my ideal rosacea regime, I think there's a hierarchy of things, right?
Oh,
so
go on
I'm,
then.
I'm all about hierarchies.
Okay.
Honestly, I talk about this a lot. But actually getting like the hydration stuff first of all. So making sure your cleanser and your moisturizer are right.
Okay.
Sun protection in rosacea. Show it to us.
Here we go.
I love it. I love it. So sun protection is absolutely key. And you've got Anthelios, which is fantastic. Some people are even more sensitive. And then I would advise a mineral sunscreen. So, the pure zinc oxide, titanium dioxide one. So I don't know, but anybody who doesn't know, I'm going to skin-splain a little bit.
Brilliant. Yes, absolutely.
So there are two types of sunscreens that we tend to have. There is chemical, which is like the Anthelios, and it's got big molecules, which can be really, really helpful to protect against UV, but can irritate the skin a little bit. And then the other side, there are mineral sunscreens, and they're made out of zinc and titanium, and they can be much, much easier to tolerate and less irritating.
Okay.
So sometimes when I am using sunscreens in rosacea, I will use a mineral sunscreen. And actually, Anthelios, I saw today on Instagram, have just brought out a new mineral sunscreen, which comes in lots of different shades, and often they're tinted.
Yes.
So that's really nice. Jan Marini, look, I did bring something.
There we go.
I bought something.
We're all doing a show and tell.
Yeah. Jan Marini Physical Protectant, one of the really, really useful ones as well. So there are a couple that you can use. And I think that's key because UV exposure is definitely implicated in rosacea as making it worse. So if you can protect. So that's definitely my second one. And then I might add in a vitamin C antioxidant after that.
Okay.
And I really like C ferulic, but it's quite a high percentage. So it's, well, not high. It's moderate percentage of vitamin C. It's 15%. And I love it, but it's pricey. I mean, yikes!
I know.
And if you're on that sort of luxe, budget, that's fantastic. But often people are asking me like for much, much cheaper ones.
What would you recommend for a lower price point, Emma?
So I think it's quite difficult actually. But I tend to start at 10% vitamin C. SkinCeuticals do a serum 10, which is 10%, but that's also pricey. La Roche-Posay do one, but that's in hyaluronic acid, so it's a bit thicker. Vichy do one.
Yeah.
And then Clinique will also do one as well. So those are the ones that I quite like. People often like, if you are doing very well on your lower percentage of vitamin C, 10%, you can sometimes increase up to a slightly higher one. And there's a nice one that's done by Timeless, which has got vitamin C in. So a few different ones that you can use. Vitamin C is fabulous. Do you like your C?
Yeah. What I noticed when I started using it was I felt like I had a bit more clarity to the rest of my complexion.
Yeah.
So even though the redness in terms of flushing and texture goes up and down, and I can't really do a lot about that, the likes of my forehead would then be completely clear, and then there'd be certain patches where, from a makeup perspective, I would only really need to put a big patch of makeup maybe on the red bits, and I could leave the rest and kind of get away with it. So that's the difference I think it's made. And I think for me, a big thing that the main concern I have is trying to manage that texture that can come with the rosacea. Like, what would you say? In fact, for me, a flare-up is when I see the texture. What would you say if you're having a flare-up of your worst version of red? Are the steps that you can take to kind of calm everything down again?
So I think if you're having a flare-up, you need to get some form of treatment, or unless you can find a particular trigger. So say, for example, you've gone a bit heavy on, I don't know, the retinols, or that you've added in a product, or that you've gone crazy for the Prosecco, or something has actually triggered things off, then just ease back on any actives. Just take out your actives, cleanse, moisturize, sunscreen if you need it, and just let the skin calm down. If it's not calming down with that, that's when medical treatment comes in. And sometimes I find that actually even with skincare alone, it's not quite enough to calm things down. And that's when you might need some medical treatment. And we've got some great treatments out there. I think sometimes people are a bit negative about treating rosacea, but there's so much that you can actually do. And then
what would you recommend? Like, what are your kind of key treatments that you would recommend people to try?
So I was saying to you earlier, I've got this really definite sort of progression of things, and I think it can work really, really nicely. So cream wise, we've got azelaic acid on prescription, and they're called Skinnerin and Finacea, and that's something I might start with, sort of milder changes. Or another cream called Sulantra. Have you ever used that?
I've never used it, but that was one of the questions someone asked. Let me find what they actually asked. Okay, someone asked, this was Charlotte, Skinnerin and Sulantra. She said it seems to lose efficacy, and is that a thing?
So I think there is a point where sometimes the rosacea is too active to actually be treated with creams alone. So sometimes when somebody comes into clinic, I'll say, look, I think you need some form of tablets as well. Or what happens is using sort of Sulantra and Skinnerin, and it's good for a while, and then you have a flare of rosacea, and you might have to pulse in a different treatment, and then you go back to sort of your maintenance treatment. So I think, unlike certain other creams, it's a really good question, because there are some creams that we know work for a bit and then stop working because your body gets used to them and your skin gets used to them. But I don't have that quite so much with Sulantra and Skinnerin. So Sulantra is a great new cream that came out a couple of years ago, and it's really good when you're very, very inflammatory and irritated. It just is quite calming, and I quite like the combination of Sulantra and azelaic acid. But if it's not working, we have got other options to go for, so that's really good to know.
And what are some of the other most popular kind of prescription options? Someone's asked here about a low dose of, I hope I'm going to pronounce this properly, Isotretinoin.
Yeah, exactly. So the next step, after I use something like Sulantra and Skinnerin, I then go on to a course of antibiotics. And when we're using antibiotics tablets for rosacea, we tend to use them for longer periods of time. So often people are on them for like 3 months, which I know seems extreme, but we use them as anti-inflammatories, and they can have some really, really good effects. And then we'll stop them at 3 months, we'll keep going with creams, and then we may have to say pulse in a course every couple of years or something like that. But if people aren't responding, Roaccutane or isotretinoin, which is what the question was about, can be really, really useful. It's got me out of some really tricky rosacea situations. So I do use it, and I think, but it tends to be like a third line treatment if I haven't used it, if I haven't had as much success as I wanted to with other treatments.
And I suppose what is kind of really coming through, Emma, as well, is there isn't a cure as such, is there? But you can just really manage the onset of the redness and keep it as calm as it can be.
Do you know what though? Right. Sometimes when people come in and we talk about not being a cure, I feel that there's like a huge amount of disappointment around that. And I know it's disappointing. Like, obviously I would much rather say, right, there you go.
Come on.
3 months, done. I won't need to see you again. But in the absence of having that, what I say is, okay, we're not going to focus on the fact that we can't cure it. We're going to focus on the fact that we are going to manage this to a level that it doesn't interfere with your life quite so much. And I have to say, I think most of my rosacea patients will agree that actually we do manage to do that. And so it is all about managing it. But if you can manage it successfully, and it doesn't interfere quite so much with day-to-day life and like confidence and what you do and, you know, all of that sort of stuff, then I think you're still winning, I think.
Yeah. No, of course. I mean, that was another thing I was going to ask you about. I know that you're very vocal about the fact that there's lots of lifestyle changes that you can make or tweak to really get a handle on it. What are some of the kind of quick wins that people can change to see if it makes a difference?
I mean, I'm like a broken record, but sun.
No, I know.
So much about sun. And, you know, if you're starting to notice that you've got mild changes, do not go out in the sun. Sometimes immediately sun in some ways can almost make things feel a bit better. People are like, I feel tanned and it makes me feel better and whatever else. It's just a no. So sun protecting, really, really important. Smoking and alcohol have been associated with it. So trying to sort of moderate alcohol intake. And I'm not even necessarily talking about the immediate flush from alcohol, because I think that happens with a lot of sort of redness prone conditions, but just generally maintaining like a good lifestyle, sort of clean eating, trying to reduce the inflammation that you have within the body. So smoking and alcohol, trying to avoid that. And we know that smoking really affects the blood supply to the face as well. And we know that blood vessels in rosacea aren't working in quite the way they should do. So that's definitely something to avoid. And then diet. So trying to make sure that your diet is as healthy as possible and is really a balance of like antioxidants, so lots of different colors, fruits and vegetables, trying to keep sugary foods at a minimum. We know that sugary foods have quite a profound impact on the skin. So really trying to keep that, what we call the glycemic index of your diet. So things that will release sugars within your body. So like sugary foods, cakes, biscuits, sweets, and then refined carbs, white bread, white rice, white pasta. So I think diet, lifestyle, UV, all of those can really influence you know, how your rosacea progresses.
I've seen a lot of speculation about celery and celery juice. Is that something that you would recommend or you've seen good results from?
No, not necessarily. I think so. I'm just going to be totally honest.
No, yeah, that's exactly why we want to know. Yeah,
not really. I think there are so many other ways, and sometimes excessive, like huge consumption of celery can almost make you more sun sensitive in some ways. So I'd be a little bit careful about that. I'm not one for extremes. I mean, who can really be bothered with that much celery juice, and unless it was really going to transform it, right?
Yeah, absolutely.
Right? If it was going to do it, we'd be on it.
We'd all be on the celery.
But it's not. You know, save your money, do something else. You know, get a nice broad, you know, get lots of different coloured fruits and veg, and you know, switch all your white bread to like wholemeal alternatives, something like that, and then a bit of celery is great.
Another one, I'm jumping from one to another here, but as I said to you the other day, literally I was like, I'm going to bite the hand off Emma and ask her every possible question. It reminded me when we were on about the sun, someone also asked me about LED lights, and would you recommend LED therapy, and like how does that work with rosacea?
Yeah, I mean, LED has been shown to be helpful more so in sort of acne and anti-aging. So there isn't a huge amount of data in rosacea. It does have some sort of anti-inflammatory effect. And so if there are situations where I couldn't use any other treatments, for example, pregnancy, that's sometimes when I'm like, oh, no, there isn't as much that we can use. And so I might go for it for there. But for me, it just doesn't do enough. And like I was saying about the celery, I mean, I can't be bothered to do things that don't really help. Frankly, if I'm going to do something, I'm going to go to the time and expense and things like that. I really want to see results. And I think with LED, it might have mild anti-inflammatory, but it's not going to have enough sustainable effects. So I personally would rather go for a laser in that context.
When do you think you reach a point where you start thinking, I'm going to go for laser? And how does that work for someone that hasn't considered that as an option yet?
So I think this is such an important point, and it was something that I wanted to, I should have brought up when I was talking about medical treatment. Generally, medical treatments work really, really well for spots. As a sort of very quite medical dermatologist, i.e. somebody that doesn't do as many sort of lasers and things like that, I can treat the spots and like the dryness and flaking and all of that, no problem with rosacea. But when it comes to the flushing, that is definitely something about the way the blood vessels work. So the blood vessels sit too close to the skin. So normally your blood vessels should just come up when you're, I don't know, gone for a run or something like that, and then just shrink back down. And they lose that sort of elasticity, that really nice, like dynamic nature when you get rosacea, and they sit too close to the skin, and also they come up too much. And to change that really is a mechanical thing. There were some creams out. Some of you might have tried Mevaso and some other creams, but they weren't very good. And we found they were not effective as part of the routine. So laser is really the thing. If you're flushing a lot, and if it's redness without spots, without dryness, without flakiness, that's really your big problem. Laser is going to be the thing that can help you the most.
Okay.
Yeah.
Because that's, I think, one of the things as well that I find myself talking about a lot. There are all of these different types of rosacea, aren't there? So there isn't really one rule of thumb for one person, because it's almost a case of everyone having to identify, are you targeting flushing, dryness, texture?